Hi, everyone, and welcome to the 31st episode of Vitals and Voices. I'm Lathika, and I'm the founder and host.
And I'm Alessandra, a volunteer for Vitals and Voices, and together we serve on the executive board of Vitals and Voices.
Vitals and Voices bring together diverse stories in healthcare to build a supportive community for the future generation of medicine.
Please welcome our guest, Dr. Tharshika.
Dr. Tharshika, thank you so much for joining us today. We're truly honored to have you on Vitals and Voices. To start us off, could you please introduce yourself and share a little bit about who you are and what you do?
Yes, thank you so much for the invitation. I'm really happy to be here. So, my name is Dr. Tharshika Thavayogarajah. I'm a MD who was born and raised in Germany and worked in Switzerland, in Zurich, at the University Hospital as a hematologist and was getting trained in internal medicine as well. And I always was interested in cancer research, and that's how I basically along my life, I always tried to be like a researcher and a clinician. And at some point, I was like, I want to do more. I want to get more knowledge and do more in this field. And that's why I applied for a postdoc. And now I'm at Harvard Medical School and at the Mass General Hospital as a postdoctoral scholar to do cancer research.
That's great. You shared that your journey into medicine began when you were just 16 years old after meeting young patients with leukemia. Can you tell us more about that experience and what inspired you to enter healthcare?
Yeah, absolutely. So I would like to start with a saying which my mom always told me. She was like, education is the key to success. And when like you can see, I'm a woman of color, and growing up in Germany, I belong to the minority. So it wasn't always easy. I also got bullied in high school because I was brown. So I was like, I want to do something meaningful with my life and I want to believe in myself. And so I was always like good in like natural sciences, like biology, mathematics. I was 16, but in Germany, you have the opportunity to do an internship in any place you like in the summer holidays. So I was like, okay, I'm good in like biology, mathematics. Maybe I can become a doctor. Like this was like a crazy idea. And so I just wrote like applications to different hospitals and I got invited to one of the, yeah, bigger hospital at a university hospital. And I think the professor was having fun because he was like, "Oh, I've never seen such a young person like, interviewing like for an internship at this hospital." And so I did an internship in hematology and oncology in Germany at the University Hospital in Münster. And what was so fun is like there was a female attending, like she was an oncologist, and she was the first female attending an oncologist who became the first director in pediatric oncology. And when I was doing my like internship there, she like inspired me a lot. Like she was like a role model for me. And also there was like this incident, like I was like going with the doctors for rounds, and then there was like a little boy. He was like, I think around 14 or 15 years old, and the nurses were like making his room so beautiful with a lot of decoration. And I was like asking the nurses, why are you like making the room so pretty? And they were like, yeah, because it's gonna be his last birthday. And I was like, why? And she's like, yeah, he has cancer. So he was like similar to my age. So I went into this room and we talked with each other. And he was like, why are you here? And I'm like, yeah, I'm doing an internship because maybe I want to become a doctor. And that's when he just like said, maybe you can, like, help me one day and heal me one day. And that was like the turning point of my life because suddenly I felt like, okay, this is maybe a purpose. This could be something which inspires me to go on and be in cancer research. And that's how I developed the dream with 16 years old to become a hematologist and go into cancer research. And 16 years later, I'm here.
That's really wonderful, and it's so inspiring to see how you just started at 16 with the internship, and then now here you are. How has your background and lived experiences shaped the way you approach patient care and research today?
Mhm. So when I was studying in medical school, like if you get all the knowledge, you just see like there is no differences like in ethnicity. Like, let me give you an example. When I was a doctor in Switzerland, I had a patient where they believe that the size of her spleen is normal, but because she's coming from a different country, which was basically, and she's from one of the countries in Africa, she basically had a spleen which was too big for her and which was causing her a disease. And that's when I also understood like it's so important to look at the differences in ethnicity, in like race, in gender, like all the clinical studies done in the last 50 years were mostly tested on men and less on women. So when I traveled around the countries, I worked like as an intern during my medical studies in Singapore. I was in the United States of America. I was in Switzerland, in Germany. I even was in Israel, and I felt like there are like so many differences we need to be aware of, and that some things are not similar for all of us because we are all different. And especially like, the different ethnicities and races have maybe different anatomical issues or different like blood counts. And that's something which I learned during these internships, that things are different. And also, what I learned is that if you work in a diverse environment, you have multiple perspectives on different cases, and you get so much more interesting, ideas and also like suggestions how to treat patients because there are guidelines which are very important, but it's also always important to see individually what this person or patient has. Yeah.
Amazing answer. Your work today spans both clinical care and leukemia research. What continues to motivate you to keep going, especially during challenging or emotionally intense moments?
hmm Yeah, to be honest, being a doctor is not always easy. And right now, I'm starting again my journey of being a researcher, and research tends to be frustrating because not every time something will work out. Like most of the times, things doesn't work out. And it's about being persistent and having the grit to not give up. And, I think what I built during the last years or decades, I would say, is resilience. So I think resilience is very important to keep on going and also to have an intrinsic motivation, meaning like for me, sometimes when things get tough, I think back on the conversation with this young patient who told me like maybe one day. And I also feel like, for instance, I'm working in research in acute myeloid leukemia, which is a disease which is still treated like, yeah, 30 years ago. There are some small changes, but if they have a high risk form of it, it's really difficult to, heal them. So that's why I feel like I want to do some change. And this is what's keeping me going because I feel like, if you have this privilege to actually study medicine, have the possibility to do research, and I know I worked very hard for it, but I still think it comes with a responsibility to give back because we all should do something also in service to others because that's how I feel like community and society should work. Yeah.
I definitely agree. So you said before that you're deeply passionate about leukemia research, particularly understanding the genetic and the molecular mechanisms behind the disease. So why does this area of medicine matter so much to you personally?
Mhm. So during my medical studies, I already did some research and I did mostly like protein biology, biochemistry, and I felt like, to understand a disease, also when I see a patient and they come with symptoms, we always has to go to the root of the cause, like what is actually causing it. And I feel like in leukemia, genetics play a huge role and we don't understand everything so far. So, for instance, I cannot tell so much about my project, but what I can tell is I'm studying like the genetic level to understand what kind of changes might cause a bad cell to survive and multiply so that it will develop cancer. So, I feel like that for me, genetics is important because I believe that this could give us an answer how to treat cancer better.
That's a very interesting insight. In addition to your scientific work, you also are a strong advocate for gender equity in medicine. What challenges have you observed, and why do you believe addressing these inequalities in is essential for the future of healthcare?
So, when I was starting to study medicine, I was just Googling for a female director in hematology in Germany. And it was 2013. Like, it was actually a new modern era of living, and we see women everywhere. But I couldn't find a role model. I couldn't find a woman who's basically a director in this field at a university hospital in Germany. There were some, and there are some in the United States of America. There's a lot more women being in leadership roles. And I just didn't understand how a country couldn't have women in these high positions. So I also made a survey Germany-wide. Like I made a survey and asked like, what is the issue? Why don't we actually pursue like academic career with a leadership position in hematology? And the answer is most of the women are not getting the support to actually pursue a career. And also like biologically wise, like if we get pregnant and we have like a different lifestyle, we have kids, we are busy, but how do you still pursue a career if the system is so strict and is not allowing you to, do a part-time or cannot do part-time with research and have kids? So I think it's like a systematical problem. So the reason also why I'm personally so much involved is because I've seen that even though you're good as a woman and you're bringing great results and you're hardworking, you're doing your best to achieve, even if you're a doctor and you see that nepotism, like meaning if you're an important person, like if you're a son of an important professor, or if you have some important connections, and we all know networking is important and knowing important people is important, but I still feel that gender shouldn't be a reason why you're not promoted. Gender shouldn't be a reason why you are not getting the leadership position. So I felt that there was so much inequality, and that's why I was like, I want to do some change. And that's why I'm trying to, like we say, I think in German and also in the United States of America, like break the ceiling, break the glass ceiling, try to become in positions where you basically show you can achieve as a woman anything you want, but also look out for the others, bring the other woman with you, like make change happen on a broader scale. Yeah.
I definitely have to agree. Being a woman of color, I think you've really spoken the truth about what's happening in the world, and you're absolutely 100% right. We should break the barrier. So you've spoken about making a promise to yourself at 16 to become a hematologist and cancer researcher, and now you're doing that exactly at Harvard. Congratulations.
Thank you.
What does that accomplishment mean to you today?
So, when I was younger, I was like, yeah, that's maybe a dream, And then, like 2 years ago, when I basically got the scholarship to become a postdoctoral scholar at Harvard, I couldn't believe it because these dreams come true to people who are privileged, who already have everything, who for them who's like already known, oh yeah, for sure I'm gonna go on Harvard because I have every resources to go there. And for me in the first moment, I couldn't believe it. I was just like crying out of happiness, like, is this really true? Is this happening to me? And then I still couldn't believe it until like I arrived here. Like I just moved like 2 months across to the United States of America. And like the moment I was here, I basically felt like, wow, I'm really here. And I remember I was walking across the streets and I was like looking around me and I was like, this is really happening. I was like so overwhelmed with my feelings. And I even like cried at work because I was like, is this true? Like I was like pinching myself, like, am I really here? And then the moments kicks in where you're like, and now I want to make change happen, meaning like now I see it as a privilege that I got here, but also as a responsibility to, I want to take this chance and make the best possible outcome I can have. I want to work hard, do everything I can to make my dream come true. And yeah, that's how it feels like, also this feeling like it's a reward to never give up because sometimes it feels like you're so exhausted and you're tired and you cannot deal anymore with this injustice because you are working hard and you're not getting the chances and you're doing everything to achieve your dream. And sometimes you want to give up. And the moments like when you actually make your dream come true, it's like, okay, this is why it was worth it. And that's why I always also tell to my residents or students that sometimes you just have to push through. I know it is hard and I know it sucks and I know it's not easy, but sometimes if you have a dream, I always feel like you have a dream because it's there to become reality. So that's why I always like say, don't give up and keep on going.
That's a very inspiring answer. As a clinician, scientist, social entrepreneur, and mentor, what core values guide the way you practice medicine and conduct research?
So I think the most important thing is to be honest with yourself and with your surroundings, because integrity is one of the most, I believe, important quality as a doctor, because you have to be honest about like how you approach things, and if you don't know something, it's always important to ask people like, what do you think about it? So that is something very important. Being curious, like being like you want to know more. So you want to like ask questions and you want to read more. And I also think like one very important value is to, be grateful. Grateful for people around you, for the opportunities you have, for like, that you wake up every day and every day is a new chance to make this world a better place. And also being like hardworking. I believe that, yeah, like there's this, kind of discussion, and I feel like nowadays you discuss between smart work, which meaning like working the minimum but doing it in a smart way, which I think is really important. Like do not overdo it because we are so important as human beings. We have to take care of ourselves, but also do the hard work. Like, it's always easy to take the easy path, but I'm not sure if the easy path will always lead to the path you want to be. So I think integrity, being grateful, being hardworking, being kind to others. I feel like that's so, so important. I feel like as a doctor, like we see patients struggle, and sometimes patients are frustrated and angry, and they lash out. And I do understand because, like in our system, we cannot always, like I said, we cannot always cure diseases. So, yeah, things might get difficult, but still try to be kind. I feel like kindness brings you a long way because that is what people value. They value, there's this beautiful saying from Maya Angelou, like, people don't remember titles, people remember how you treat them. So, I feel like that's very, very important. Yeah.
Yes, I definitely agree. And to wrap things up, our final question is for students and young people listening who may come from underrepresented backgrounds or face barriers in pursuing medicine, what advice would you want them to hear?
Mhm. So first of all, I believe the most important thing is like representation matters, and sometimes you don't find a role model. Like in my case, I also didn't see like a brown woman being in a high position in medicine. But I believe that the most important thing is still believe in yourself. Like believe in yourself that you have the capability and ability to achieve anything you're ever dreaming of. And also have a good network, meaning like have people around you who believe in yourself, who love you, who care for you, and who wants the best for you. And I know it's sometimes also nowadays with all this digital, Instagram and so on, it's not easy to make friends. And it's not about the quantity. You don't need to have like 10, 20 friends. Just have one or two good friends. I think that's very important. And also try to push yourself, meaning like I remember when I was like an intern, I was at this big conferences, but I always saw like a man stand up and asking a question, and the first woman, I think it's different like in Germany than to the United States, but the first woman back in the 2015 or 2018 when I was at the conference was like after five men already asked a question, the woman came up. And so I made my promise to myself, like when I go to a conference, I want to be the first person to ask a question because I want to be this role model and people will follow. So I think being brave is very, very important. And also take care of yourself. Like you are the most precious, important being to yourself. And it's not selfish to love yourself and to take care of yourself, meaning like giving a break if you're tired, meaning like, just like saying no to things, even though you feel like, oh, I have to go because all my friends are going. But if you're like, no, I'm so tired, I just want to like, be with myself, just go for it. I feel like the key to success is somehow to take care of yourself, to do something maybe in service also to others, to change, to help change the world or help make this world a more beautiful place. And I also believe that like, to be kind and also to have integrity, like to be honest and good to yourself and to the world. And yeah, just believe in yourself, work hard, believe that doors will open. That's very important. Like a lesson I learned is that not sometimes we feel like we want something and the door is closed and we cannot like go there. And I feel like sometimes it's because another door is opening and because sometimes reroutes are the best routes to actually achieve your goal. Yeah.
Certainly well said. Thank you so much for sharing your journey, your insights, and your purpose with us today.
Your resilience, compassion, and commitment to equity are so incredibly inspiring, and we're so grateful that you joined us on Battles and Voices.
Listening to this episode for of Vitals and Voices.
If you enjoyed this conversation, be sure to follow, share, and stay tuned for more stories from the voices shaping healthcare.
And we'll see you next time.